I know when you do your massage, you're kind of doing the treatment and you're assessing as you're going.
hmm
So could you kind of talk us through
hmm
that approach there then?
Yeah, so during the massage treatment,
Hmm.
you're palpating, you're feeling for those those structures as you're going along to see kind of what the texture is of the muscle, and
Hmm.
then
Hmm.
you know, is this, and um, you can tell through that if it's due to an activity or if there's something that's stuck, like the muscle tissues aren't gliding back and forth um, very well, and then you can, you know, pick up on, you know, is there, you know, is this muscular, or is there maybe something else going on in that area? So yeah, I mean, there's depending depending on the presentation, that will determine the techniques that are being used, you know, whether if it's like cupping or something that, you know, if the deeper muscle layers need to be addressed, or if it's something more superficial,
Hmm.
or, you know, or sometimes there's something going on in a different region, so sometimes it needs to be addressed, you know, something further down or farther up the anatomical um, chain. So um,
Yeah, and
yeah.
I like what you said about you could kind of pick up if something's else, so you probably can
hmm
sort of figure out a little bit. I mean, you're of course extremely good at palpating the quality of the muscle, but you
hmm
probably do at least enough where you get close enough on the muscles where you feel maybe how restricted the spine could be,
hmm
and that could
hmm
sort of tip you off to say, "Hey, I'm going to do a great job with massage,
hmm
but maybe we need to get to
hmm
somebody that can help the function at your joint." Because
hmm
I know that's what happens back in our office. Just kind of
hmm
reverse engineer that, where it's like, hey, we're working on these muscles,
hmm
and I'm working on the spine. But if I feel like, you know what, I can get some of this muscle tension melted down, but with the
hmm
time I'm allotted and the tools I have in here,
hmm
I'm not going to get it all the way. So you
hmm
need to go over and see Ben and let him stick the TNT into these trigger points and these tight muscles
hmm
and bust that up for you some too.
hmm
Um, Now, as far as our treatment approach, right, I like to do a lot of dynamic movement, lots
hmm
of orthopedic tests, range of motion, general movement.
hmm
Apply the McKenzie exercise protocol first. So I'm starting with, hey, let's get you on exercises first, and then depending on what kind of exercises you could tolerate, that's going to really guide us and paint the picture to what sort of things we can do on the table as far as stretch, decompress, and what sort of adjustments you could really tolerate in that.